Hi everyone, my name is Beheprizada and apologies for not being able to present this in person. So I'll be talking about automated remote pulse oximetry system, ARPOS, which I have worked on as part of my PhD. So I am studying, I'm doing a PhD in computer science at University of St Andrews, and my research title is Smart Homes for Older Adults to Promote Health and Wellbeing. So within that, I initially started looking at different aspects of smart homes and health monitoring. However, then I was specifically interested in monitoring physiological health and therefore working on remote pulse oximetry, for which I have collaborated with Beyond Medics. And I use a Kinect camera to get heart rate and blood oxygen levels remotely. So people can be sitting around in a room or walking around while the system would remotely measure their heart rate and blood oxygen levels. So traditionally, pulse oximeter clip is used where it is mounted on the finger of the person um, and measure heart rate and blood oxygen. ECG is also used to monitor cardiovascular activity, and blood test is also used to measure blood oxygen levels. However, that can be invasive and painful. With pulse oximeter or ECG or any form of contact-based health monitoring, it can be difficult to do so with adults or um, younger children if they have any form of severe illness or physical or mental incapacity. It can also be burdensome and uncomfortable for patients to wear it for long periods of time. It can restrict movements, and also it carries carries increased risk of infection. So for this purpose, remote pulse oximetry would be more useful. In addition to that, especially in setting of a triage or clinical setting, it can be hard to identify a declining health of a patient using contact-based health monitoring, where every patient has to be individually assessed if their health is declining. However, in a remote pulse oximetry system or a setting, multiple patients can be assessed at the same time, and declining health can be identified instantly. I'll show a demo at the end of this presentation. So it can be used in different settings. It can be used to monitor health of isolated older adults, people with dementia, hospitals at home, clinics, triage, A&E triage, care homes, psychiatric hospitals, where patients can be a risk to themselves and to the staff. So I'm just going to now step by step walk through, give a high level overview on how this works. So to validate the system, I actually also conducted a research study as part of my PhD, where a Kinect camera, which takes IR, color, infrared and depth data, was plugged into a PC or Xbox, and a ground truth device, such as a commercial pulse oximeter, was also worn by the person, and vitals were recorded from both of the devices, both of the systems, such as ground truth and ARPOS system. And then for validation, I compared and measured the accuracy of the ARPOS system. So, so the ARPOS flow consists of data acquisition, where participants were interacting with the ARPOS system. And then once the data was collected, I did post-analysis to apply different algorithms and pre-processing techniques to identify which technique works best best in comparison to the ground truth for measuring heart rate and blood oxygen levels. The first step is frames, and by frames I mean it's a video analysis, or you can also say image analysis, because it's just images over time. And for this example, Kinect took 30 frames per second data, so analysis on every nth frame, just so that it processes it faster, as when we move, we won't drastically move for a few frames. And so to speed up the process, we can do that for every nth frame and apply our analysis. And then face identification, which means, as you can see, that once a frame has been identified, I identify the face and remove the full frame, and then extract the regions of interest a bit later. So once I've identified the face in color frame, then I map it to infrared images and depth images. Um, for this slide, I've just shown a modified version of infrared image just for visual purposes. And once coordinates in color image have been identified, I simply map them um, to a infrared and depth image and extract those pixels. So once the mapping is done, ROIs will be extracted. And so here I am using DLIB to identify the regions of interests from the face. So I've shown it for color and infrared here. Um, and this was done on the server side. So I collected the data on the server, and I just copied it to my PC, to my lab PC, and then I ran the application where it would identify the faces and extract the in regions of interest such as lips, forehead, and cheeks from the face in color and infrared, and then store it separately. And then I would apply pre-processing on all the data that's collected. And by pre-processing, I mean different types of things such as detrending signals to remove any certain variations that might exist, spatial pooling, normalizing, interpolation, and smoothing to denoise the data. And finally, then I applied noise reduction algorithms or component analysis, where I applied ICA, PCA, JADE, SE, and several other combination of these algorithms um, to remove further noise. And then I applied Fourier transform. So Fourier transform is just converting a time domain to frequency domain, and then that frequency would help identify the heart rate. Once I've done so, I applied filtering. So there's different types of filters. It can be low pass, high pass. I used band pass, so that means the heart rate cannot be less than 40 BPM or more than 200 BPM. So applying a band pass would only select those specific frequencies that I'm interested in, and then measure heart rate from there by identifying the highest peak on a specific frequency. However, for blood oxygen, it's a slightly it would be using actually the raw data, that raw signal that has been extracted from the ROI, and using a filter on gray signal, and then directly using that to identify blood oxygen. So to find heart rate, even though our naked eye doesn't see the changes on our skin, every time our heart beats, our skin flushes lighter and darker over time, and this can be calculated or measured by measuring that pixel intensity over time and extracting that signal, applying frequency, a Fourier transform to get the data in frequency domain, identifying the peak, and then finally getting the heart rate in BPM. While for blood oxygen, a ratiometric measurement by dividing the pixel intensity between two different spectral regions, such as red, which is between 600 to 700 nanometers, and then infrared between 800 to 900 nanometers, we can then measure the oxygen level. Um, So just a quick demo of showing how the real-time system works. So people are just walking in and the system actually extracts these regions of interest by identifying the phase, and then because for real-time system, it's actually using skeleton tracking with Kinect, and then identifying these pixels from different channels, and then measuring heart rate and blood oxygen as I explained previously, and then displaying that on the screen. It also shows the error rate on the screen of how reliable the reading is, and the reliability. So the blue line is showing the reliability for the heart rate, which by over time the error rate gets smaller, and similarly for the blood oxygen as well. So thank you for listening to me, and if you have any questions, please feel free to email me. I am active on emails and I would be happy to get back with any questions you have. Thank you.